Hello there and welcome. This week we're looking at healthcare delivery but in a rather different angle. Well, it's often said that medicine is as much an art as science. Now today we live in more enlightened times, and vast improvements in our knowledge of how the body works in sickness and in health have laid the foundations for the medical advances that have occurred in the past 100 years or even close to a century. The scope and pace of medical research in our modern world are so wide that nobody can absorb it all in. Believe me, even specialists working in a single field of medicine can sometimes find it hard to keep up to date. You may be wondering, what exactly am I talking about anyway? It's none other than medical research and what gains it has impacted here in Nigeria. So we decided to visit the Nigeria Medical Research Institute in Lagos to find out the goings on there and what's been in the works in terms of its programs and other activities, challenges and prospects for the near future, just to mention a few. Now, the mandate of the Institute under the Enabling Act of 1977 stipulates that it shall conduct research into diseases and problems of public health importance in the country. Our guest is no other than the Director General of the Institute, Professor Innocent Uja, an obstetrician and gynecologist who assumed leadership in June 2010 as he bears his mind on issues affecting the Institute vis-a-vis its mandate and other research activities. Please stay with us as we bring you this interesting interview. I'm Ayatunde Balogun, and it's question time. Professor Innocent Uja, you're welcome to Question Time.
Thank you very much.
Now, it's a great pleasure to have you with us this week, looking at the activities of the Nigerian Institute of Medical Research, which you are the Director General. Now, let's start off right away. I mean, the Institute, as big as this, or NIMR, to cater for the medical research needs of Nigeria, looking at several diseases that are, commonly known to so many of us in this part of the world. Would you say that the Institute is really accomplishing its goals of, of detecting some of these diseases as a research institute and providing some kind of, should I say, solutions, in tackling some of these diseases that we're talking about?
The Nigerian Institute of Medical Research, the foremost medical research institute in Nigeria, came on board very early in the 1920s, and this as a follow-up to the West African mission of the British Council regarding yellow fever in epidemics in the West African sub-region. And since then, it has moved on to the point where it is now, for the Nigerian Institute of Medical Research. At one point, it was National Institute of Medical Research, it was West Africa, National Research Council of Nigeria. We've been able to reposition the organization to respond to national health priorities, research priorities, and we do just that. We wouldn't say that we have arrived. We need to move on. Knowledge is a continuum. The seek for knowledge and use of knowledge to improve the health care of our people is the mandate of this institute. And we will have tried in our own little way to look at that. For instance, issue of malaria. At the moment, issue of vaccine production for malaria has been on for a very long time. Up to now, there has not been any vaccine that now been certified as the one that can be used against malaria. But there are other treatment modalities and prevention strategies. The issue of insecticide-treated nets, indoor residual spraying, and then, of course, treatment. We used to use chloroquine. We have now moved to artemisinin combination-based therapy. And we need to put this into proper perspective. We're using insecticide-treated nets. We know that the insecticide can become ineffective, to the vector, which is mosquito. And we are tracking that resistance at the moment.
In other words, are you saying that mosquito nets have a lifespan?
Well, it used to have a lifespan, but the long-lasting nets have been developed, and this goes for about 4 years, without having to wash and then reuse or embed the insecticides. So in a way, if a lifespan of a net is up to 4 years, then of course we would have been achieving. But the problem is that after a while, will this still continue to be effective? That's a research question, and that is what we are tracking. We are also tracking issue of antihistamine-based combination therapy, what we call ACT. Now, it is effective, that is true, but will it remain effective? Just like chloroquine. Chloroquine used to be the drug of choice for treatment of malaria, but it has developed, I mean, the Plasmodium falciparum has developed resistance against chloroquine now, and then we now graduated to artemisinin-based combination therapy. We need to track and inform policymakers, the government, when we ever think that there is going to be, or any evidence that there is going to be resistance. So that is one area that we're doing. We're looking at the vector component of control of malaria, and that is very important. It's a common condition. It actually is responsible for over about 60% admissions of Nigerians. And if you look at the economics of malaria, you know, you'll be amazed at what we lose. Because if a productive workforce is down with malaria, it means that we're losing money. The economy, because the productivity will go down, and then we'll lose money. So what we do to continue to sustain whatever we are doing, indoor residual spraying, we'll do that. At the moment, there are some research activities going on in places like Nasarawa State. One of our vector control, our entomologist is involved with the National Malaria Control Program. And we document our facts to be able to let policymakers and the public know how far it can go. So at the moment, that is where we are laying our emphasis while looking for other areas as far as malaria is concerned. Tuberculosis. This Nigerian Institute of Medical Research is a national reference lab. We have upgraded our laboratory service where we now have what we call the Biosafety Level 3 laboratory for multi-drug resistance. Multi-drug resistance is a situation where Mycobacterium tuberculosis has become resistant to the first-line drugs. And what we do is to track this. Which one and where and how? Who are the people that are most affected? That is what we are doing. And then we have been upgraded. We have a lot of up-to-date equipment. We have gene experts. We have polygotyping. You know, we have midget machine. That these are things that would tell us whether they are resistant, because the cost, economic cost of treating a case of multi-drug resistance, TB, is a lot. So whatever we do, we need to prevent it from happening. One of the ways of preventing is identifying the problem very early, rather than spreading it. I mean, if it is one case is spread all over the place, or is even transported internationally, that's a big problem. So we are doing that, and we also are looking at cancers. At the moment, apart from breast cancer in women, cancer of the cervix is the commonest cancer, and it has a telling effect on our women. It kills women in large numbers. Unfortunately, Nigerian Institute of Medical Research commissioned a COBAS 4800 machine that will screen for human papillomavirus, the virus that is known to cause cancer. At the moment, there is no national data on the prevalence of human papillomavirus. We now know that it is a cause of cancer, but we need to study the prevalence. Apart from that, we can do the genetic study to determine the subtypes of human papillomavirus. At the moment, the vaccines that are there that have been produced to prevent human papillomavirus infection is against subtype 16 and 18. But the other subtypes. Now, the question is are these two the commonest type we have in Nigeria? Are they as common as they are reported in other parts of the world? We need to know that, and that's a research question. And the essence of this is that if we are able to find out, and as I'm talking to you, we have a stakeholders meeting nationwide, people coming from all, gynecologists, pathologists, microbiologists coming from all over the country. We're holding a meeting currently to determine how to go. Now, if we find that it is the subtype 16 and 18 that are commonest in this country, then of course we would then inform government. Yes, what is found in other places is the same as here, and therefore we can then recommend that young girls, 9 to 13 or 14, should be immunized against cancer of the cervix. That's what do you call it? Human papillomavirus, a virus that causes cancer of the cervix. But if it is not, then again we then have to link up with the industry.
Now, Prof, when you say link up with the industry, what exactly do you mean? What are you saying?
Well, what I say link up with that? The pharmaceutical companies that are producing these vaccines are now producing against type 16 and 18. Because it's assumed that that's the only one that is causing, those are the only ones that are causing cancer of the cervix. But if we now found that we do not have that prevalence in this country, we let the government know. We also would then let the industry know, because we have cancer of the cervix. So if we then look at the predominance of the subtypes, it is possible then that we link up with the industry. Say, look, this is a subtype that we have. It is now necessary for us to produce vaccine against the common ones that we have in Nigeria, not the one they report in Europe and America. So in a way, it is not only to save cost, it is to be cost effective and also to inform policy. And I think that is the right thing to do. And as a foremost research institute, this COBAS 4008 and 4,800 machine is the only one of its type in Nigeria. There are only 3 types. You have one in South Africa, you have one in Botswana, and the third one is in Nigeria, and it's in Naima. So in my opinion, I think that's a great achievement.
Well said, Prof. But again, I wonder, why is it taking it so long, for us as a country to acquire this machine, to detect a human papillomavirus, that can cause a cancer of the cervix?
Yeah, there are other ways. There have been other ways. It's just that as technology improves, we have to move with the technology. We have what we call cervical smear, pap smear, but it's not as effective. It doesn't characterize the subtypes of human papillomavirus. It will say whether, in fact, the woman has some risks of developing cancer of the cervix or not. Now, this one specifically studies the virus and the subtypes. So we are moving with the technology. When I was a medical student, it was thought that herpes simplex type 2 was the cause of cancer of the cervix. And a lot of people, not only in Nigeria, Nigerians, the gynecologists had written their PhDs in this direction. But we now know that herpes simplex type 2 is not the cause of cancer of the cervix, but human papillomavirus. So it is a changing times, and we are responding to the changing times. And I'm happy that it is NIMA, the Nigerian Institute of Medical Research, that is a trailblazer on this.
Now, Prof, we can't help but to talk about the issue of funding, because I feel that's a big challenge for this institute. How do you go about tackling this issue?
The issue is that there are many dimensions to this. The first dimension is that Nigerians do not value research. Value. If you don't value anything, you don't, you may not be aware. If you are not aware, you don't value. If you don't value, you don't invest. And that is the situation with health research and all forms of research in this country and in many developing countries, because the belief is that it's only government that should sponsor or commission research. It's not true. I mean, Bill Gates is not a government. Ford Foundation is not a government. The Clinton Foundation is not a government. But they not only provide service, they also support research. Why is it that Nigerians who are well-to-do cannot commission research? We are talking about breast cancer. Women dying of breast cancer, and it doesn't spare anybody. I would have thought by now that somebody may just say, look, Naima, what can you do about this research on breast cancer? We've taken it upon ourselves to look at cancer of the cervix. We are not being supported by anybody, but I am committed that we must have a national figure, national data, to be able to inform policy of government. So this is the problem we face. We don't value research. We don't value research, and if we don't value research, we do not invest. And if we don't invest, we have funding from government, but that is not sufficient because of other competing needs. We want to have to have better funding, to improve our infrastructure. This place started in the 1920s. So clearly, there will be dilapidation of facilities, of structures and the rest, and they need to be replaced for us to be functional. Two, we need to move research from mundane epidemiology to other, because we know that other institutions, universities and the rest also carry out research, but we need to refocus. We have a molecular biology and bioinformatics in this place, and we need to go into the molecular level, and that's what we are doing. For instance, when we were young, when we were medical students, they thought that peptic ulcer is caused only by stress. We now know that it's an infective agent that causes peptic ulcer, Helicobacter pylori. And we have a department of molecular biology and biotechnology in this place, and a very good researcher who is working on Helicobacter pylori. Now, these are some of the things that, and we now know that with antibiotics, you can treat peptic ulcer. So that myth about peptic ulcer and stress have been reduced. I wouldn't say had gone, but have been reduced. You can use antibiotics to treat peptic ulcer. So that is from research finding. And a situation where people think that no, it's because of stress. No. Even when we give drugs, we monitor the drugs and see whether, in fact, they continue to be effective. I mean, like antibiotics, anti-malarials. Okay, for instance, here, we have a large volume of patients who we are treating for HIV. We have over 21,000 cumulatively, both children, men, women, pregnant women. And I can tell you that because of the facility we have and the commitment of our staff, we've been able to reduce perinatal transmission, that is mother-to-child transmission, to 0.87%. Or if we were not on any drug at all, right? In pregnancy, the mothers were not on any drugs at all. Probably the perinatal transmission would have about between 20 to 30%. So we're doing our best, but you see, we are one of many. And I believe that if every part will be doing its own, it then becomes a complete whole. And then we'll have a national response that is appropriate. But we also need that there's more investment. We have facilities, laboratory facilities, that can detect and characterize hepatitis B virus, C virus, HIV, viral loads, right, CD4. And I must thank the government of Nigeria and partners, because the partners are supporting us. Yes, partners are supporting us. We have extensive
assistance that probably you get from other partners.
Yes, I mean, the biosafety level 3 lab for TB, MDR TB, that was commissioned only yesterday, by the Minister of State for Health, Dr. Ali Pate, was built and furnished by U.S. government, using FHI 360. So this is the type of partnership that we have. We also have partners with Harvard, we have with Northwestern University, we have with International Association of Public Health Institutes, that tends to help us improve the quality of our laboratory services so that it can be accredited properly. We call it SLAMTA. Yes, and if we continue that way, we then will reduce the burden on the federal government and the state government. And it is also true that the state governments need to do more in area of research. We don't talk of local government because I think they need to be strengthened themselves before they strengthen health research. So if we're able to remain focused, I can tell you, and not only that, we're building capacity. We are not just building capacity of our staff, we are building capacity of other researchers and young scientists. For instance, you'll be amazed at the number of applications I get every day for IT students in the university.
Well, are we really getting enough of, from the universities and other tertiary institutions in terms of the research that you're talking about? Are they really coming out in large numbers to contribute?
Well, I think they're doing their best within the limited funding that they have. I think one thing the federal government did in the 2013 appropriation is the fact that all the teaching hospitals and federal medical centers now have a budget line for research. It was not there before, and this is an improvement. And it is, as a result of the increasing need to use research to inform policy. So we believe that if we can be properly funded, our facilities are renovated and improved upon, then of course we would be home and dry. As part of our contribution to knowledge, we are constructing an e-library, and it's gone to an advanced stage. I don't believe that a research institute should exist without a library, because we must continue to reference, we must continue to seek for information, and with the internet facility that we will have e-library as soon as it's completed, and we hope that before the end of the year, or by middle of next year, it should have been completed. And then we will have the state-of-art library, where not just our staff, but any other person who would want to use the facility can come in, because library is a custodian of knowledge.
All right, Professor, let's just hold our thought for a minute and just go on this quick break. And when we return, we shall continue with our discussion. It's Professor Innocent Ujah, the Director General of the Nigerian Institute of Medical Research, here with us. Stay with us, and we'll be right back.
Fun, inspiration, and knowledge. That's what you get from readers, writers, publishers, and the entire book world. Get some interesting reviews, events, interviews, and latest updates from the book world. The channel's book club, inspiring you one page at a time.
Welcome back. It's still question time on Channels Television. Professor Innocent Ujah is our guest. He's the Director General of the Nigerian Institute of Medical Research. Quite a lot has already been said, and we're still continuing with our discussion in this second part of the program. And what's your view about the issue of many Nigerians, talking about the wealthy ones in our society, going abroad and trying to get some medical treatment? We talk of medical tourism, which many people say we are losing so much money in terms of traveling abroad, to seek medical assistance, when we can actually get some of these things right here.
Well, let me just say this. You see, we operate democracy, and democracy allows for fundamental human rights. Anybody can go to anywhere and seek for treatment. There are other people that come to Nigeria, but we need to improve. You see, it's not just facility. We need to even improve our attitude to patient care. Because one of the problems I face as a clinician is that our attitude to patient care leaves much to be desired. And apart from that, we need to also improve our maintenance culture, what we call preventive maintenance. Like in NIMA here, we have agreements for preventive maintenance. We don't allow facilities or equipment to break down before you maintain. And I believe that it is one of the things to do. The other thing is that we need to continue to improve our training. Nigerians are very intelligent. All we need to do is to have an enabling environment. And the situation is clearly much better than now. Medicine is about confidence. Even when we're within, there are some patients that they will want to see a particular doctor. No matter whatever you do, it is that doctor that he or she would want to go and see. And you can't prevent her or him from seeing such a patient. That's right. So why we continue to improve on whatever we have. In the 90s, the 80s, we had Indian doctors all over the place in this country. They've gone back to their places. They have looked inwards. They have then continued to improve the quality of care and their facilities. But I must tell you that these hospitals that Nigerians go to are not government hospitals. So the rich in Nigeria should build such hospitals and pay our doctors well. They will get better service. But you see, that is for the rich. We are talking about the rudiments, the primary health care. Right? Because what percentage of Nigerians go there? Over 70% of Nigerians cannot. Even more than, in fact, maybe not 90% of Nigerians cannot go for services in a way. So what we need to do is to improve the primary health care facilities. And that has to do with the state governments and the local governments, not federal government. See, each time there is problem of health, they will say federal government. That is a lie. Health is on the concurrent list. And the state governments and local governments should do more. I'm sorry. Some are doing, but they need to do more. Primary health care facilities are abandoned. They are not being taken care of. And the MSS program, that is the midwife service scheme, or the federal government is working. But they need to be synergized with the state governments and local government. Need to support it. Otherwise, it will just will not be sustainable. So, by and large, the 10% or so that go, in fact, not up to 10%. But the truth is that when they are going, it's a huge loss, economic loss to our people.
I want us to look at this interesting issue, which has propped up time and again, which has to do with traditional medicine, practitioners. Some of them, over time have come out to say that they have what it takes to get a cure for this dreadful disease, HIV and AIDS. And on the other hand, the orthodox doctors, orthodox medical practitioners are saying, how is that possible? What are your facts? What are your claims?
That's
How
right.
can you prove this? And it just keeps going back and forth. Is there some kind of a war going on? Can't we have some kind of synergy? What's the conflict all about?
There's no conflict. We work on evidence. And we believe that we must go through the due process. I think it was about 3 or 4 months ago, somebody from Benin, a dean of faculty, came up and said he can cure it. We all said no. And it's not true. You see, you don't go to the press and say you cure AIDS. There are channels of presenting your findings. And these are scientific conferences where you find that this will be thoroughly debated. Some of how you can even improve on whatever you are doing will be debated. But in Nigeria, you see, there is a lot of deception among our people. Unfortunately, Nigerians are a little bit gullible. They take anything that comes, and that's not correct. They must verify. That is what science is all about. That is what science is all about. If I say that I'm doing this, somebody else in Zaria will say, well, what he says he's doing, let me see whether it is reproducible. And when it is done, you say, yes, what he said, what he claims he does is true. But, when there are no standard, no regulatory body, I believe that the National Broadcasting Commission should begin to sanction all these people that lay claim to anything and deceiving Nigerians and killing them, because I think many of them take concussions, they die. Nobody reports that. And that is that's the unfortunate thing. And they are working on, actually playing on the ignorance of our people. In fact, some of them are not even, some of them are very well educated. But you see, psychology is a very interesting thing.
Going forward, holistically, you're into your 3rd year as the Director General of the Institute now. What other prospects do you see for the Institute by the time you leave the mantle of leadership?
The Institute is in a good state to make tremendous progress. It's in a good state to make tremendous progress. All we need to do is to sustain and improve on what we're doing. Is it capacity building for health researchers? Is it improving the learning environment or research environment? Improving the welfare of our staff to be comfortable, training our staff to improve their health research capacity, continue to partner with other agencies and organizations within and outside. Because these are the things that will help us to grow. We don't have all the knowledge. We need to train, we need to acquire knowledge, we need to acquire experience, we need to share experiences, we need to present our activities in conferences, we need to sponsor our researchers to go and present their findings, both nationally and internationally. And I believe that and then of course we need to continue to improve on the structure that we have. Many of them have undergone dilapidation. We need support, to renovate and refurbish some of the structures that we have. And of course, the library. I expect that if that is one thing that I achieve as a DG, I would have done a lot, in my opinion. But most importantly, is creating an enabling environment for people to work conducive.
No doubt, research is a critical aspect of modern-day science, this time health or medical, whichever you may prefer. Now, what we need to know as a people is how well do our treatments work in the real world after performing countless researches in our hospitals or laboratories. These treatments could be drugs, surgical techniques, therapies, or anything else used in a person's care. Now, for the Nigerian Institute of Medical Research, it believes that more efforts should be put in by it with a bit more help from the federal government or the government at the state and local levels, the private sector, other renowned health institutions at home and abroad, and the general public to help change the fortunes of our healthcare system, especially primary health, to rid the country of communicable and non-communicable diseases and provision of facilities for research in collaboration with medical schools and universities. Well, that's our package for this week. Don't forget to send us your questions, comments, and suggestions to questiontime@channelstv.com, or you can also watch us online at channelstv.com. Until next week, it's bye for now.